Hey there, my name is Malia Milby, pharmacist, CEO, and co-founder of Hometown Health System, located right here in Campbellsville, Kentucky. I'm really excited to share an opportunity that I had a couple of weeks ago to share our heart and passion with the General Assembly at the Workforce Taskforce Committee hearing in Frankfurt. We were able to share a limited look into our passion and our why for things that we identified right here in our hometown of Campbellsville that were really causing generational cycles of addiction, hopelessness, chronic disease, so many things that affect the whole person. And truly my heart is to really break generational cycles and make an impact beyond my lifetime, beyond the lifetime of Hometown Health System, to bring generational change and restoration to hometowns, not just here in Campbellsville, here in Kentucky, but across the nation.
Thank you guys very much. So it's a great opportunity to share my discussion and presentation following Putting Kentuckians First. I think that shifting our mentality to fund programs like Putting Kentuckians First has to become a General Assembly priority. You know, when I think about, we can all agree that we've done an incredibly better job of increasing access to care, increasing the number of licensed beds in Kentucky and programs in Kentucky to help specific high-risk populations like justice involved, as well as people with substance use disorder behavioral health. However, how have we done? What is our Kentucky scorecard on continuity, follow-up, as well as quality of care? And when I really ask myself that question, we have to really consider, do we need to shift our focus and our funding and how these individual entities are getting funding to run programs that are not performing at a level that we need to see for focusing on workforce? So just to kind of give you a brief overview about my company, our whole passion is driving change that we individually sought and found in our hometown. Gaps, all the things that were shared with Putting Kentuckians First are happening in hometowns across the Commonwealth. Specifically for us, we started as an independent community-based pharmacy. And uniquely for a lot of justice-involved patients and those with substance use disorder, the thing that sticks with them over and over, every level of care, is their medications, is their health care. You can't expect someone to show up to work if they're physically sick. And so over the last 5 years, our company has expanded to a systemic approach to address the very issue of questioning, do we want to keep funding programs that are keeping people sick and in jail and punitive punishment for low nonviolent crimes, or do we want to shift our messaging and our focus to empower programs like Putting Kentuckians First, to empower community-based collaboration and invest in putting Kentuckians back to work? Our heart is breaking generational cycles for inclusive, whole person healing, not just in Kentucky, but I believe we can put Kentucky on the map for a national change and shift in how substance use treatment and jail system reform can be achieved. I'm not going to spend a lot of time with workforce barriers. When we think about the partners that the Hometown Health System has established with the Kentucky Chamber Foundation, for example, we are specifically focused and have looked at across the country. What programs are we doing really well in Kentucky? What programs are out there across the country that are performing very well? And how can we change how we're funding and incentivizing that to take place right here in the Commonwealth? Education, transportation, low-income housing, food insecurity, childcare. You all know all of this. This is spoken about in numerous discussions, but it is a critical issue that we have to look at. So when we start thinking about the 10,000-foot view, let's talk about where we are with workforce participation in Kentucky. We're currently ranked in the bottom. We are currently ranked 46 with workforce participation in the nation. We're at 57.6. So I'm like, that is astonishing, right? But let's dive into that. Let's understand what that means and what percentage of that is specifically related to our justice involved or patients that are suffering with substance use disorder. When you extrapolate that information, we really have worked closely with the Office of Drug Control Policy, and Van Ingram's team has done an incredible job, and some of the programs that they have implemented in Kentucky are second to none. This is a bipartisan focus to really look at what does workforce participation look like. So when you start to break out how many of that percentage are specifically failing our workforce because of substance use disorder, it is significant. And Senator Wise, and I don't remember the senator that were asking about some of the adult programming, and I would venture to say, when you look at the rates of men versus women that are incarcerated or suffering with substance use disorder, it is a higher statistic in our male population. And so that is going to unequivocally affect our males getting back into the workforce. So this number, many of the case studies, there was a study out of Princeton University that looked at what percentage of this in Kentucky actually are focused for just substance use disorder failing. We're around 40, even some suggest even up to 80% of this 57.6 is specifically because of substance use disorder and justice-involved clients. Fentanyl overdose is the leading cause of death in Kentucky, more than car wrecks, more than cancer, more than heart disease, stroke, heart attack. It is significant. When you look at our court system, our incarceration rates, compared to the national average and some of the things, we have a very high statistic, and a majority of these inmates are nonviolent, first-time drug possession offenders that are sick with substance use disorder, that do not have the appropriate access to get medical care and to get back to the basics, getting back home to the family model, getting back to work. It's pretty simple. When you start looking at the numbers that this significance has caused to the workforce, $310 billion in 2023 was lost due to productivity, due to addiction. Medical costs through the roof. The indirect costs associated with incarcerating individuals, $1.2 trillion. So where do we go from here? What are the solutions? We, as I mentioned, have looked across the country and have looked at a specific case study that involves programs like putting Kentuckians first. It's happening right in central Kentucky. We have integrated comprehensive leading industry medical care through our duly accredited national specialty pharmacy to engage in first-hand response in what we can do to change this messaging. Discharge planning starts on day one. The very first time that someone offends, someone is detained, or someone goes into treatment, we have to begin exactly what was described with putting Kentuckians first. We have to look at funding and engaging in peer support and lived experience individuals that are focused on case management, empowering our first responders and law enforcement with social services support, not just targeting the clients that are suffering, but the families and the individuals that are the ripple effect that ultimately causes this to generationally impact and economically impact our local communities. It is significant. We have got to look at how can we move from a reactive posture to a proactive. And so when we look at what that can look like is incentivizing programs that empower and support self-sufficiency. The programs that are doing well, looking at that scorecard, we need to be funding those and weed out the bad actors. If they're not helping people fully heal, if they're seeing recidivism rates high recidivism rates, if we aren't seeing them enter into the workforce, owning a home, all the social and environmental pieces that show that someone is self-sufficient, those are the health systems, providers, pharmacies, recovery centers, jail systems. We need to start incentivizing the pay structure and reimbursement to support and allocate more funds for programs that are more reactive in their response. When we have, over the last 18 months, we have piloted a case study. Some of the statistics on the following slides are a result of that case study, that within the state of Kentucky, we have comprehensively supported substance use treatment, algorithm, and continuity for aftercare planning for justice-involved, residential treatment programs, and outpatient treatment programs. We have combined some of the leading national programs like Safe Off the Street for emergency shelter initiatives, comprehensive intake, peer support assessments out of the jail systems, like putting Kentuckians first, looking at an individualized, phased approach that's community-based, looking exactly what he was talking about, county to county specific, region specific, to empower local invested dollars that ultimately can change the trajectory of the economic impact that we're seeing that some of these issues are causing. And ultimately, it affects our employers and our ability to empower individuals with that self-sufficiency, secondary education, all the things that you've heard today. It is exactly where we have to begin to shift our focus. We have to look at reducing duplication. We are on that bottom tier of the workforce participation. We have to look at empowering programs like the Fair Chance Academy, empowering second chance employers' opportunities and job fairs in our detention centers, empowering and incentivizing specific programs to help our local first responders and law enforcement that are in the streets right when the first overdose happens. Things like Casey's Law, empowering programs to decriminalize and allow more individuals to get help from the very first offense instead of allowing them to have multiple reoffenses until they get to a felony level and they now have a felony record that then prevents them. 20% of that population cannot have specific job types because of their felony record. Overcrowding, overspending, and really poor outcomes with healthcare has continued to cost trillions of dollars in our nation. And we have to make a difference. We have to make a shift. We have to make a change, because it's not just talking about these people and our workforce participation right now. There is a specific correlation between substance use disorder increase and workforce participation decrease. I am proud to report people do recover. There are sustainable solutions, and there are incredible champions that are so passionate. There are jailers, there are judges that do see the benefit in these programs. Nationally, we're around a 58% relapse within 1 year of current substance use programs, current jail system programs, and drug court parole probation programs where they're returning back reoffending. What is the implication of that? What is the impact of that? What is the economic cost of that? I'm talking our ambulances, our law enforcement. We can't even have enough money to fund our county jails to have enough jailers and deputies to support the inmate populations we have now. Looking at each of these areas, let's shift from the reactive response to a proactive response with more career readiness and empowerment to incentivize payer structures that support these types of initiatives. Speaking to that specifically, when we looked at what this case study showed us, the Medicare Star Rating program that was launched in 2017 specifically rates health systems and providers based off of performance as well as consumer impact and reporting that allows them to decide. Our DOCs should be doing referrals to those residential programs and incentivizing programs based off their performance. If those clients are recidivating, if those clients aren't finding jobs and partnering in these initiatives, those should not get the referrals for patients to seek treatment at those locations. That's automatically how you can weed out those bad actors. Right now, looking at direct and indirect savings through these initiatives, we're saving around $27,433 per justice-involved individual in our care and seeing 68% of individuals still maintaining sobriety and looking at all parts of that. And there's so much more to this number, but in the time that we have, I'm happy to supply some of that information as well. But this is the story. I wish I could have time for story after story after story. People can recover. Hope can be restored to our Commonwealth of Kentucky. And I believe that we have the leadership in place that believe. I just spoke with the governor a couple of months ago. We have to shift from a reactive to proactive, and part of it is focusing more effort on the aftercare and follow-up and retention. Mr. Gribbins was an individual who was in the correctional system and was basically going to become evicted before he came into our care. We were able to get him comprehensive health care. We were able to, actually, this bike was donated. He couldn't read and write. We work with our local career center to help this individual fill out a job application. And he has been hired on at one of our second chance employers in Taylor County, Maricomi, which is a leader with the Kentucky Chamber as a second chance employer as a result of the Fair Chance Academy that the Kentucky Chamber Foundation has instituted. And Mr. Gribbins is still in employment right now and now owns a home for the first time. These are the type of stories that we have to see the impact. I believe that we have what it takes to shift the narrative, not just for the Commonwealth of Kentucky, but for the entire nation. I'm super proud of the work that's already been done in this area, and individuals like putting Kentuckians first, our veteran populations. This affects everyone. 4 in 10 Kentuckians are affected by substance use disorder or are diagnosed with it. This has got to be the core focus of this General Assembly and how we can maintain and shift to see empowerment and self-sufficiency and improve our workforce participation. Thank you.
Well, Dr. Milby, thank you for your passion. Thank you for the investment that you're making in your community. I would love to hear more stories. We need to find some avenue to hear those stories because those are very powerful. So, but thank you for what you're doing. We do have a question, Co-Chair Wise.
Thank you, Mr. Chairman. I'm going to call you Malia instead of Dr.
Okay.
Milby because I've never called you Dr. Milby in my life. I want to also thank Lindsay Howard for being here as well. And there's so many people part of your team that are doing wonderful work in Taylor and the whole surrounding region there. In your presentation, you really hit a lot on being more proactive and not reactive. You mentioned names like Van Ingram. You even mentioned Governor Beshear. You've called us out as state legislators. What more in terms of state leadership can we be doing of what you're seeing? Because you're everything you're doing with Hometown Connect is just so holistic. It's affecting so many people. I think a lot of this starts at home, and I appreciate the faith base you're doing because you've got to also tackle this issue in the family fabric of our culture that's breaking down in a lot of areas that we can't solve that, but places like Hometown Connect and what you're doing can. So the question is, with state leadership, what more can we do?
Thank you for the question, Senator Wise. I think that, and Putting Kentuckians First mentioned it, but we've got to focus on more community-based collaboration. We were just actually, our leadership team attended one of the Fair Chance Academies in Marion County yesterday. They're doing some incredible work. There are champions, as I mentioned, out there that are just as passionate as I am, that are seeing these types of success stories. J.Lo Brady, just very, advocating for these types of programs. Warren County, they have a reentry program that we work closely with through, I think that's through Putting Kentuckians First. So there are great programs out there, but there is such a significance in the silos. All of us are wanting to do these great things. I think if we can look at streamlining incentive-based payer reconstruction and reimbursement, we have got to align this vision in more of a collaborative effect through community-based engagement, like the Medicare Stars ratings. Let's restructure Medicaid. Let's look at more of incentive-based payer structure so that we can empower and reward people that are focused on this type of healing and hope and restoration versus continuing to pay for a lot of the programs. They're doing some good things, but ultimately we still see a very stark gap with people really receiving the care that they need, and then we're spending a lot to do it. So I think there has to be a shift, and I love to continue the discussion and talk specifically of what I think that could look like. And one more thing, there are significant community-based centers across the Commonwealth through core funding. That's the opiate response effort in Kentucky and the Office of Drug Control Policy, the HIDA. I don't know if you're familiar with HIDA, the high drug trafficking programs. Some of that federal funding right now is focused to look at the Learning Life Center, I think is in Kenton County. Those types of investments aren't just local, but the programming, prevention programs from our schools, a shift in those types of programs is where we can see a true intervention and shift.
Thanks, Amelia. Thanks, everybody at Hometown, for what you're doing.
Thank you.
While this was just a snapshot of all the work that we have been working towards accomplishing at Hometown Health System, our longitudinal research and so many parts of our company infrastructure really is so exciting and innovative. We have shattered the glass ceiling with some of the things that we are organically developing right here through this journey. I'd love to have the opportunity to share more about my heart, my passion, and the impact that we're making in hometowns across the nation.